Hi, my name is Taylor. I'm 27 years old, and I cannot eat by mouth anymore. So, what that means is I have a couple of chronic illnesses, a laundry list of chronic illnesses, but the one specifically that doesn't allow me to eat anymore is gastroparesis, which is under the umbrella of full GI dysmotility, which I also have. So gastroparesis specifically does not allow me to eat by mouth, but I do have esophageal dysmotility, which just means things take longer to get from my esophagus to my stomach. And then I have gastroparesis, which is stomach paralysis, and then I have intestinal dysmotility. Sorry about the fire alarm chirp. Intestinal dysmotility, which means my intestines don't absorb like they should. And then I have colonic inertia, which just means my colon is also delayed as well and doesn't work like it should. I was first diagnosed with gastroparesis in 2023, but I've been having symptoms since 2021. And it just progressed. I lost 50 pounds. I wasn't already very big. I grew up very small as competitive cheerleaders, so losing 50 pounds was pretty detrimental. I did not look healthy at all. I was not healthy at all. And after several GI doctors in my college town trying to diagnose me, they tested me for Crohn's and celiac, other IBD diseases, and they all came back negative. They did test my gallbladder. I did not have gallstones, but the HIDA did show that my gallbladder was working only at a certain percentage, so it wasn't working at all. So it needed to come out. So I got that taken out, and they said that should help my nausea and vomiting. It did not. Newsflash. A month later, I was still throwing up everything that I ate. Drank from broth, ice chips, Jello, soup, yogurt, French fries, steak, but like from the small stuff to the big stuff, I just was not able to absorb. Fast forward to 2024, I was placed on a 2023, I had a gastric pacemaker placed. And what that basically is, it's like a pacemaker for your heart, but for your stomach. And it does not cure gastroparesis. It just helps with symptom management if you have nausea and vomiting. Now, if you are a patient with gastroparesis and your main symptoms are not nausea and vomiting, and they're just like bloating or pain or just nausea but no vomiting, then you're likely not a good candidate for the gastric pacemaker because it just wouldn't bring you any relief. It doesn't help. It really only targets nausea and vomiting, specifically vomiting. So I got that placed in June of 2023. I got my port placed in December of 2023 because my veins started to collapse and develop lots of scar tissue around them because I got fluids and medications, IV medications so often because I was so chronically dehydrated from vomiting every single day throughout the years. So my veins just don't work. Like you can't get a good stick, you can't get a good peripheral stick anywhere. So I got a port placed in December of 2023, and I receive IV medications, IV fluids, but blood draws, everything from it. So it's a power port. It's great. May 2024, I still wasn't getting any better with the gastric pacemaker. I was still getting lots and lots of fluids. Instead of going to fluids once a week, I had to go to fluids several times a week. So my current GI said that a feeding tube needs to be placed. So I got a surgical feeding tube. I got a surgical GJ, a gastrojejunal feeding tube, which goes through my stomach, and then there's a longer tube that bypasses and goes to my jejunum, which is my small intestine, and that's where I feed from. I do not feed through my gastric port, but I am allowed to decompress or drain gastric juices to prevent me from vomiting, so that is very helpful. Fast forward to now, I'm still not better. In fact, I'm worse. I was put on palliative care after a month-long hospital stay from December to January, and my doctor said this is all that they can do. There's nothing else that can be done. I'm not eating orally anymore. I'm not able to tolerate my feeding tube, which is this. I haven't ran this in probably a couple of weeks now. That's my feeding tube pump. Not able to tolerate J-tube feeds. Wasn't able to tolerate any of the nausea medication they gave me IV, such as Reglan, Zofran, Promethazine, Compazine, Haldol, Droperidol, couple of other ones, topical, rectal, which is suppository, IV, pill crush. I wasn't able to tolerate anything. I was vomiting 24/7 while I was inpatient. Like the entire month I was inpatient, I was just throwing up, and I wasn't eating either. So they started me on TPN. TPN is where you receive, I think it stands for total parenteral nutrition. And then a feeding tube is just internal nutrition. Sorry. Had a brain fart. So TPN essentially is where you have a central line. You can either have a port, you can have a Hickman, you can have a PICC line, where just a main access port that's not just like a regular IV. It's a long-term access point, because it needs to go into a deeper vein. And basically we trialed that for a little bit, but I was not a good candidate for it long term because I do have liver issues. I have liver issues because I am malnourished. And when you don't get a lot of nutrients, a lot of protein, your liver starts to break down, starts to not work and stops working. And if you didn't know, TPN causes liver issues long term. So they said you already have pre-existing liver issues, which ironically is from malnutrition. So we cannot send you home on TPN long term for the malnutrition. So catch-22. I was then placed on palliative care. Palliative care referred me to hospice. Hospice said that they couldn't pinpoint my exact end date, nutrition-wise, since I wasn't receiving J-tube feeds by mouth. I wasn't drinking, I wasn't eating, I wasn't absorbing anything. I couldn't go home on TPN. They said that, your death date could be 6 months from now, 6 years from now, 6 weeks from now. We don't know. So we can't exactly leave her on hospice. So we need to put her back on palliative care. So that's what they did. They put me back on palliative care. And then about a month later, palliative care dismissed me and said, I am too complex. You need full home health. So I don't have home health now, full home health. I do everything myself. I access my own port. I run my own fluids. I do my own IV medication. I've been taught by my medical professionals to do it. So it is under direct supervision. But right now I am just currently in a flare. And nothing, I can't keep food down. I haven't eaten anything orally in probably 2-ish weeks, maybe more. And I haven't ran my feeds for just as long. So I am rapidly dropping weight. I went to see my primary care a couple days ago. He did diagnose me with failure to thrive, secondary to gastroparesis and intestinal dysmotility, and daily vomiting. So what's in the works is there's a surgery called a GPOM, I believe, or a POP procedure. And basically that means where they go into your abdominal wall and open up your pyloric sphincter. It's like a valve at the bottom of your stomach, and it closes and opens so food can pass through. Mine is completely shut, so food cannot go through, and it's likely the cause of my gastroparesis. Now with that procedure, it's not 50-50, it's a 50-50% chance success rate. And because I am so refractory with every single treatment option that is out there for gastroparesis, they're not very certain that it is going to be a successful surgery for me, but we're kind of desperate. They said they wanted to try this. If this did not work, then my next step would be gastric bypass, which I don't meet the weight requirements for gastric bypass. So it would be strictly for gastroparesis. And it is a big deal since it's not for weight loss. It's just, it can make gastroparesis worse, and we don't need that. Also, I don't have insurance. I'm 27. I lost my insurance when I was 26, off my parents' insurance, so I'm not able to get a lot of the Medicare. I'm not able to get a lot of the medical care that I need, including this procedure. The hospital that most of my specialists are at is covered with financial assistance, so that's nice. But none of the doctors at my hospital do the POP procedure or the GPOM procedure. So I have to go to the hospital that placed my pacemaker, and those surgeons are going to do it. But with that, I don't qualify for financial assistance. They denied me twice, and I cannot get through to them. So I have a GoFundMe that I'm raising for, that I use for medical needs and stuff until I can get insurance. I have applied for disability. I am in the works for that. It has been expedited because I was placed on end-of-life care, but it's disability, so I still haven't heard from anything. My lawyers are working on it, so that's great. But then also, side note, once you receive the disability, your insurance doesn't start for another 24 months. Let that sink in. So I don't think it would matter anyway. I obviously can't wait 2 years for this procedure, so I'm kind of just in a decline, and it's quite scary, but there's nothing else I can do. My primary care told me, I'm just trying to keep you out of the hospital. That's why I do fluids every single day. I do IV medication every single day. Fluids, like I said, fluids every single day. I'm not tolerating my J-tube feeds, so right now I'm just living off of IV fluids to keep my body hydrated. If I did not have IV fluids at home, which I didn't in the past, I would have to go to the ER, and I can't keep going to the ER, so we just did it at home to make it a lot more easier. But yes, some of my symptoms that I would like to talk about are for gastroparesis and just into GI dysmotility period, I guess you could say. Obviously stomach pain, bloating, vomiting, nausea, weight gain, weight loss, difficulty swallowing, sore throat, diarrhea, constipation, all the GI symptoms that you can think of because your GI tract does not work. Basically, your GI tract has a whole set of nerves that are separate from the body's nerves. But what we feel like it is, gastroparesis and GI dysmotility is a motility issue, which means it is a nerve issue. So there are signals that tell your stomach to contract and digest. For some reason, the signals in my GI tract don't connect, and they don't tell my stomach to digest, so they just don't. My stomach is paralyzed. It just sits. The food will just sit there until I throw it up. That's why like raw vegetables and fruits are the worst for gastroparesis, which is ironic. That's something your body needs, but they don't digest. The thicker the food, like steak, raw veggies, chicken, fish, protein, fiber, those things do not digest, and it's very awful because those are the things your body lacks anyway, so you need it, but it lacks it because it can't digest it and it can absorb it. So a lot of people get that from their tube feeds, or they'll get it from TPN. And then when you can't use your tube feeds like me, you don't get it from anywhere. And then also, I'm still throwing up even when I'm not eating. So I haven't eaten in a little over 2 weeks now. Maybe it's about 2 weeks, a little over 2 weeks. And I have not eaten anything by mouth. I tried one time and it came right back up. It was rice. Came right back up, and it was just miserable, and it hurts. It's extremely painful. A lot of gastroparesis, intestinal dysmotility, and just GI dysmotility come with a lot of comorbidities, which just means like co-diagnoses that kind of go together, and things like that. And your body just starts something called decompensating, which is something my palliative care team and my specialists have stated, that my body is decompensating. When you are lacking nutrition, stable nutrition, your body cannot do what it needs to. Your kidneys can't filter, so you have a lot of protein that spills out of your cells, and that causes fluid retention and edema, which is what I have in my legs. My legs swell due to protein, caloric malnutrition. You get shortness of breath. Your lungs stop working. I have I do breathing treatments 4 times a day, every 6 hours. So your lungs start getting really tired. They don't do what they need to do, and you got heart issues. Some people have POTS. Some people have other issues that come with that, cardiovascular issues, and some people have kidney issues, and some people have reproductive issues, pelvic floor. I don't only have GI dysmotility. I have lupus. I have pelvic floor dysfunction. I have interstitial cystitis. I think I said endometriosis. I don't know if I did. Endometriosis. Lupus. I think I already said that. But I have lots of other diseases that I believe were caused by gastroparesis, because when you don't have nutrition, your body cannot sustain life, which is why a lot of people who have gastroparesis, very severe gastroparesis, there are severities to it, but very severe gastroparesis are terminal, and they end up passing away. I'm in a group chat, or like a Facebook group for gastroparesis, and I can't tell you, at least once a month I see someone whose loved one has posted on their behalf about them passing away due to gastroparesis, because when you can't get nutrition, you're led to multi-organ failure or multi-organ dysfunction. Like I just said, your body decompensates, and eventually you lead to organ failure. If you cannot tolerate nutrition, whether that is J-tube feeds, oral feeds, TPN, you cannot survive. Nobody can survive, and you can't survive very long. You can't survive without other complications. Without nutrition, your liver can't work, your kidneys can't work, your brain can't work. I also get seizures when my electrolytes are too depleted. When my electrolytes get depleted because I'm not running IV fluids, I've gotten seizures. So your body just goes haywire, because nutrition is the hub. The body needs that. Food is your friend. And gastroparesis and intestinal dysmotility and GI dysmotility period make it extremely hard to get adequate nutrition and to just live. It's very debilitating. It is not something I would wish on my worst enemy. Currently, the only known causes are diabetes and GLP-1 medications. Mine is considered idiopathic, which just means unknown. I don't have diabetes, and I've never taken a GLP-1 medication. So currently, there is no known cause that is known by science. Currently, there's only 2 causes that have been discovered by medicine, and that is diabetes and GLP-1. So mine is considered idiopathic. So it could happen to anybody. Nobody really knows, but being a diabetic and taking GLP-1 medications can increase the likelihood of gastroparesis. But it's just not something that I would wish on my worst enemy. Life is extremely hard. I am bedbound a lot of the time. Throwing up. I'm really in the bathroom a lot of the time throwing up. If it's not throwing up, it's coming out the other end. If I'm not in the bathroom doing that, I'm in the bed. If I'm not in the bed, then I'm running fluids, doing my nausea medication, doing my IV medication. Like, it's just extremely time consuming. And for something that takes up so much of my energy, I have to do it. I do all of these things to stay alive and to stay out of the hospital, because I will end up back in the hospital like I did December to January. I also had sepsis, so you're more susceptible to sickness and you can't get over a lot of things, and it's very dangerous. But yeah, that's my story. I am on TikTok and Instagram. I have a chronic illness page on TikTok and Instagram where I just share my journey and try to advocate for different chronic illnesses and educate and things like that. So if you want to go follow me on those, that'd be greatly appreciated. This is my first YouTube video, and I hope to make more in the future. I'm also going to be showing a little bit of my medical routine, so stay tuned at the end for that. But yeah, thank y'all for watching. So a little disclaimer, normally I would run my tube feeds and do my other medications through my feeding tube, but I'm not able to tolerate any of that right now. So I'm just going to do my IV fluids, breathing treatments, and IV medication.